Hi, I am Dr. Srinivas Samavedam. I am the head of the Department of Critical Care at Virinchi Hospitals. The Department of Critical Care at Virinchi Hospitals is a 140 bed tertiary care referral ICU with 40 ventilated beds and a state of the art level 4 intensive care unit with isolation rooms facility for all the patients who come into the critical care service. The Department of Critical Care is staffed by fully qualified specialists in the department and in the specialty of intensive care who are present on site in the hospital 24/7, 365 days a year. The infrastructure that is available at Virinchi Hospital is probably on par or probably better than what is available currently in the twin states of Telangana and Andhra Pradesh. The unit has a capability of looking after patients who have problems with any organ failure and can provide support for cardiac, respiratory, renal and neurological failures. The difference between the Department of Critical Care at Virinchi versus state-of-the-art units elsewhere in the country is the presence of round-the-clock specialists who are backed by an extensively trained and well-versed team of nurses in critical care, also supported by probably one of the best lab services in the country. What sets this department and this specialty apart from the other units in the country is the fact that we follow a principle of preempting critical illness with the use of advanced monitoring technology as well as the judicious use of biomarkers in predicting and preempting certain organ failures which we can address earlier so that the patient's level of sickness and thereby subsequent recovery are made much easier. To facilitate all this is probably one of the few units in the country which has electronic data records and a continuous online visualization, recording and monitoring of critically ill patients by the consultants 24/7. Even though the on-site consultants are available to provide state-of-the-art decision making as well as support, senior consultants also have the ability to see what is happening in the ICU as well as what is the trends of the parameters of the patients round the clock 24/7 either at home or in the office downstairs in the hospital. Therefore, the Department of Critical Care is all geared and is capable of providing tertiary level and above critical care to those patients who need support for various organ failures and organ systems. One of the examples of what intensive care can do to patients who are really ill comes from one of the first patients whom we treated in this hospital as soon as the department opened. This was one of our own staff members who went to another hospital in the city with difficulty in breathing, and his heart had stopped beating in the emergency room of the other hospital. When they evaluated him, they found that his blood counts were very low and they had put him on ventilatory support. Our team of intensive care specialists went to the hospital and retrieved the patient with the ventilator and all organ systems in our ambulance. And when we came here, we realized that this patient actually had a bone marrow failure because of an infection with H1N1, which is popularly known as swine flu. We supported this patient with renal replacement and mechanical ventilation, and this patient had to be put on ventilator while he was sleeping with his face down. This is called as prone ventilation. After 48 hours after investigation and our suspicion of a swine flu infection, this patient slowly started recovering. His kidneys started improving and he came off the ventilatory support in about 8 days without any complications. Today, this particular patient is attending to his work in our structural engineering team and his family is back on track from this life-threatening catastrophic disease. This is what round-the-clock continuous monitoring of a critically ill patient backed by a team of specialists who are qualified in the field of intensive care can do to a patient. Similarly, another patient of ours who was referred to us from a remote area of the state having had a scorpion sting. Most of the time, the scorpion stings do not cause much of a problem, but sometimes in certain types of scorpion stings can produce severe heart failure. This particular lady, who was 65-year-old frail farm hand, had a scorpion sting with heart failure, and was told by several hospitals in and around her native place, as well as a couple of hospitals in the city, that nothing much can be done and to take her home. Out of desperation, they came to us, and we found that we could support her mechanically as well as with drugs, and we tried to reverse the scorpion envenomation. We supported her heart failure and her kidney function for a period of 4 to 5 days, and at the end of 7 days of hospitalization, this lady was in a position to go home without any complications of the scorpion sting effect on the heart. So a proper approach or a proper assessment of the patient's condition, along with a spirit of not giving up if there is even a remote possibility of salvaging such sick patients, is what sets the Department of Critical Care at Virinchi hospitals apart from the other units which are working elsewhere in the city. Similarly, a patient known to us who had a heart attack, but atypically, instead of just a heart failure, the muscle that separates the right side of the heart from the left side of the heart had developed a hole because of the decrease in blood supply. This, in medical terminology, is called an ischemic VSD. This is a medical emergency, and in the best of hands, only 5% of such patients survive and go home alive. We brought this patient from another corporate hospital in the city on ventilatory support. We subjected her to surgery backed by a team of extensively qualified cardiac surgeons and cardiac anesthetists, and supported her cardiac, respiratory, renal and liver failures aggressively for about 8 days in the hospital. This patient stayed in the hospital for close to 2 weeks, but was able to go home without any complications, with full recovery of all her organ functions. This is again a tribute to the monitoring and the aggressiveness with which we approach critical care, and also the very fact that a good coordinated team effort can help in improving patients' condition and salvage those patients whom the literature says less than 5% survive, is again a tribute that even though this is a new hospital, our team is fully geared up to look after the sickest of patients with organ failures which can be life threatening with a very high chance of mortality.